September 25th, 2023. I'm here today. We're going to talk about what happened over last week, any interesting things that might have come around, and what you might be interested in hearing more about, and just other topics in general if you have any. So, most interestingly, what I came across last week, in fact, it was a couple of days ago that someone got admitted. One of my patients got admitted to the hospital, and there was a lot of dissatisfaction about what was going on, how they were upset with how things were happening, and what their expectations were, and what the outcome was. And it was interesting to hear and to see the other side that the patients encounter. And the thing is, all the patients do get to say everything that they would like to say, but unfortunately, nobody gets to hear the other side of the story. There are certain things that happen in a certain way, just like the airlines. Like everybody can write a review about the airlines, how the flight was delayed, how everything was wrong, but nobody hears to the other side of the story unless like someone gets really obnoxious and gets kicked off the plane. Generally, you don't hear the other side. Again, I'm not saying that there has to be two sides. There are certain expectations when you take a flight, when you go to a restaurant, when you go for any kind of professional services. There are certain kind of expectations, and and that's where I think the disconnect sometimes happen. That with changing times, the expectations and the realities have also changed a little bit. And it just and this is not something that people encounter every day. I hope you don't have to, but people get on a plane or go to a restaurant or a hotel much more frequently than go see their doctors or end up in the hospital, and God forbid anyone has to. So here's today I didn't have any particular questions, so I will just talk about what happens and how the hospital admission happens and what is happening behind the scenes. Now, I understand the patient side because I've been to the emergency room myself with family members or friends, and definitely we're all human, so these things can happen to anybody. And I've seen the other side multiple times myself. So I understand where as a patient, one is really afraid, one is really hurried because we feel that obviously if we're not attended to immediately, that can be delay in care, and bad outcome might happen just because of delay in someone seeing them. And why can't you be seen right away? So anyways, when you fall sick, the first thing is you want to try to know, like, should I call the doctor? You're waiting for maybe just to see, like, hopefully this will get better, this will pass, and maybe you'll just take an aspirin, maybe take some Advil, some of these medications, and then hopefully it will pass. And then it sometimes gets worse and you're worried. Number two scenario is it comes on suddenly, and it's very painful or very dramatic, like you pass out, or nonstop vomiting, or a stroke or a heart attack, where there's no thinking. Suddenly there's a major change in status of a patient. and then you're like right away, like you're like, okay, we need emergency care because something is really wrong. Uh, but in the first scenario, when things are starting to get worse, maybe you call your primary care doctor, they're not available to see you right away. And then you want to go to the urgent care center, but then you're always thinking that an urgent care is basically primary care only available after hours. But then you're always torn between, like, should I see my own primary care doctor tomorrow, or I should just rather straight away go to the emergency room. And at that point, a lot of people will decide that they'll go to the urgent care because the wait won't be that much. And I don't know if patients know that, but it might be a little bit cheaper than the emergency room. And sometimes they'll go to the urgent care from where they're directed further to go to the emergency room. And you show up to your emergency room at a hospital. So this is obviously a bigger scenario. You get in right away. There's always parking available for emergency rooms, and you're registered rather quickly, and then the waiting starts. So that's number one, where suddenly you're like, but I'm at the emergency room. I've been waiting here for 2 hours. Again, I'm not going to speak for everybody, and this is just a general idea. There's obviously scenarios where things don't go as you predict, and things happen. But in general, you're looking at nurses, because when you're checking in, but there's always some nurse around, like they keep an eye on what's happening in the waiting area and what they think may be going on. A lot of times they see that if you're otherwise looking okay, it's not an emergency. It is likely that you couldn't find someone else, so you chose to come here for medical care at that time. Maybe it's 10 o'clock at night, so, or maybe midnight. But it's not an emergency in the medical world. Means it's a life-threatening emergency that if these things are not attended to right away can result in death or loss of limb or life. So that's like what is considered an emergency. Motor vehicle accident, a plane crash, falling from a building. These are all like life-threatening conditions where, if not attended to right away, death may occur, or loss of limb, like you can lose an arm, like you can lose an eye. These things happen. So if in the generally a clinically trained person can tell when someone doesn't look right. People who are like loud and screaming in pain, or they can still tell how much of an emergency this is. Nobody's downplaying your pain. Nobody is judging you. Nobody is there to not help. But in general, that's the first level of triage. Again, not perfect, but in general, if you're walking around with a hamburger in your hand and you're complaining of pain, your wait time might be a little bit higher. So then, if in doubt, a lot of times the triage team, that's the initial intake team, they'll check your vital signs. That's your second but more important sign that where they know is it an emergency or not. They are able to get vital signs, check your blood pressure, check your pulse, check how you look, what you seems, they touch you, they feel you, and they want to hear what happened. And in general, that's another big one where they'll know where you stand in line. And you can't make stuff up because these are certain vital signs. You can't really fake them just to get in there. But yeah, that leads to excessive. This is where now there are other people in waiting to be seen. On an average, in an emergency room, you might have one doctor, two doctors. Maybe in a big emergency room, you might have more. But in general, still per shift, an emergency room doctor is seeing a certain number of patients. And it really matters where who else is in the hospital at that time, what kind of emergencies. If four people came in with heart attacks, or like at that shift there was a major car accident and four people were brought in, that will increase the wait times for everybody else. And you know, I think we just have to say that we're glad that we're not the ones brought in by that as part of that accident. But unfortunately, for you don't know that, but in general, the wait times do go up based on that. So when there's no wait times, I sometimes wonder, like, why that is the case. A lot of emergency room hospitals, they advertise like no wait times, nothing is you'll be seen right away, or minimum wait times. I think that's a good thing, and sometimes questionable, like just to reach those metrics. How are these doctors dealing with, or are they just deferring major cases elsewhere just to keep their wait times low? I don't know, but you have to think, when we're dealing with this, the emergency room doctors are not taking a break. Their breaks are while they're charting, while they're doing notes, while they're doing anything. There's really no breaks for them per se. So if they're behind, they're really taking care of patients. Anyways, and I don't work in an emergency room, so I'm just giving you a perspective of the doctor who's over there. And then you get seen, and it based on what your numbers are, what your complaints are, why you're there, the doctors might order testing, as blood test, CT scan, MRI, whatever they feel is necessary based on your complaints. X-rays, ultrasounds. Fortunately, the hospital has access to almost everything except for MRIs. MRIs are reserved for major cases, unless they and for if a specialist feels the need to rule out something urgently. Otherwise, MRIs are not done, and usually they're not necessary immediately. Even in cases of stroke, the first thing is a CT scan. That's quicker. Those are done. Anyways, so when a person is seen in the emergency room by the physician, by the emergency room doctor, after that they're like, nobody has come here for 4 hours. Yes, because the doctor saw you, saw your vital signs, heard your complaints. They ordered, they don't know you, but based on a quick exam, based on your story, based on your vital signs, they order these tests, and all these tests can take anywhere from 1 hour to 6 hours to do, depending on, again, who is getting that ultrasound before you, how many people happen to be getting that ultrasound, and it doesn't matter how big of a hospital is. There's only one ultrasound tech working that night at 11 o'clock. So if there's like 3 people who need an ultrasound, whether they're looking for gallstones, kidney stones, unfortunately you might have to wait. Blood work is done by the time the hospital laboratory returns the test results. They come back, and so the turnaround time can be a few hours if further testing is being done. And let's say something came up in the test results or the diagnostics that you need to be admitted to the hospital. So now the emergency room doctor has made a decision on your behalf that this is the right thing to do, that you need to stay. Now, emergency room is just the emergency area. At that point, the emergency room doctor is making a decision whether you're going home or you're going to get admitted, and in that time in the middle, they keep you from dying. that's it. That's the emergency room doctor's job, to keep you from dying and stabilizing you, and then picking the next level of care and hand off to the next doctor specialty. So do not expect, an emergency room doctor to manage your diabetes. Do not expect them to manage your heart disease, refill your blood pressure medications. They'll occasionally do that as a courtesy, but they might refill, but that doesn't mean that they are right and this is the new plan for you. Their job is to make sure that you're not going to die tonight, and if yes, then they're going to do their best to save your life. And after that, depending on after they've saved your life, are you going to get admitted for further care, or go back home and follow up with your doctors in the community? So now that the emergency room doctor has decided that, you have a certain condition that needs further admission, and whether it's an infection or it needs surgery or whatever it is, or it needs further evaluation by specialists, once they've made that decision, their job is pretty much over, and now they are sending you to, let's say, being admitted. So they call the attending doctor on call to who's going to admit you. Whether it's your private doctor, if your doctor goes to the hospital and admits and takes care of things, they'll call them. If your doctor does not go to the hospital, then does he have a recommendation who he admits to, where they have a better communication with. And then if nobody, then the hospital may have a hospitalist group. These are doctors who basically do internal medicine in the hospital, and they only see patients in the hospital. So they will reach out to the doctor who's going to admit you, and that's it. They'll tell them the story. They'll tell them, this is a 56-year-old gentleman with a past history of high blood pressure, diabetes, etc. Came in with a headache, or he fell, or he was hurting in his belly. And we did a CT scan, we did the blood work, this is what it shows, this is what it seems like, and I think he'll need to get admitted for further care, because we're not going to get him better tonight. So he needs to be admitted, and they have a good sense of what to do, especially when a diagnosis is already made by the emergency room doctor. The emergency room doctor says, okay, this gentleman may have pneumonia and he needs to be admitted. Now, at this point, your attending doctor may or may not see you right away, because now the next step is getting admitted, the decision's being made, the diagnosis has been done, the chest x-ray or the CAT scan or whatever testing was needed, the blood work is there. So everything that a doctor needs is already there. So over the phone, they might get this information. Now the attending doctor who's going to take over has to put in orders for the nursing team, that when you go to the floors, what should they be doing? What medications to give you? Should they give you something to eat? Should they not give you something to eat? What kind of diet? Is it a special diet? What are your medications that should be continued or should be held? The decision to start certain medications, stop certain medications, and anything for pain, anything for sleep, any testing that they need to do in the morning, and should they be calling any consults, any specialists who need to be seen, and any further testing again tomorrow. So there's like tons of these things that decisions are made, and those are usually made between the attending physician and the emergency room physician. The attending physician relies on the eyes and ears of the emergency room physician, that we trust them if they made a diagnosis of pneumonia, and this is what we're dealing with. So the attending will put in orders for the admission. Used to be over the phone. These days everywhere it's electronic. So your doctor can log in from the hospital somewhere. He might be on a different floor, or in or it might be at his home, depending on which hospital and how they work. But they are able to put in all the information, and all the information is available to them, short of seeing you in person. But everything that pretty much they might need to know what to do overnight and in the next day or so is there. Next morning or like same night, maybe in the next hour, next morning, the attending admitting doctor comes in and sees you, and they already look at what happened, where what has changed since yesterday. Does your story match what the emergency room was giving? Are you better as opposed to when you showed up and as to now? And blood work is repeated, your vital signs are repeated, a lot of things become clear, and patients usually will not lie if they're feeling better. They will tell you, and then we can tell how things are changing and what's different. Now, if it's a complicated case, we might have five doctors see you, maybe sometimes more. More testing is required. Everyone comes and gives their opinion, and everything is shared by the attending doctor, and then they make recommendations. Sometimes they'll just go ahead and continue to manage, continue to treat, take action, and the nurses are just following these orders, whatever these doctors are mentioning, and most of this is already in the computer. So most of the specialists will come look at you. They can tell, assess what things are like, and then all the information that they need to make other decisions is in the computer. What medications you're on, what medications have you been on, what were your numbers looking like when you came in, what are your numbers looking like today, and how things have changed. So it gives the impression that nobody's talking to you, nobody's telling you anything, we don't know anything, nobody's talking to us, we are very scared, we are very worried. Yes, we feel a little bit better, but nobody's talking to us, nobody's telling us anything. So this is where commonly dissatisfaction starts arising. And yes, both physicians and nursing department can do a better job in keeping you updated, but that's, as it turns out, is generally not easy. One, because besides the diagnosis that the emergency room physician made, pneumonia, you still have pneumonia next morning or the day after, you still have pneumonia. You are either getting better or you are not, or you're in fact getting worse. This is communicated by one of the team members. If the lung specialist came and said that, oh, okay, things are different, this may not be pneumonia, I might have the heart is getting involved, so I'm going to do this, and and then they go ahead and do that, but they may not have communicated that to the family members because nobody was there when they came. The family members came during visiting hours. The doctors came during non-family visiting hours. Any kind of disconnect. And then the patient basically spoke with the doctor. They usually will not remember most of it, especially with so many different doctors coming in and coming in and out and testing and blood work. Probably by 10 in the morning, you've seen 10 different people, and they've all come and spoken to you, told you something. So you obviously don't remember. The patient doesn't remember most of it, and then you're looking at a family member coming. So what did the doctor say? Oh, they said I'm fine, and that's all you hear. And then the next day, same thing happens. Then the family starts asking, but then why are we still here? Why are we not getting better? What's really going on? And this is where the real issues are, and I think this is where most of the opportunities lie from both ends. If the doctors are busy, and they're busy because they are busy, they're seeing other patients. If they don't go see them, those patients are not going to get seen. And you can't stop people from getting sick. We try, but so it's not necessarily under anybody's control. So it's just a matter of understanding what's happening on both sides. So anyways, this is where the biggest opportunity is communication. But if you feel that in the hospital that you or your loved one are improving, just be honest. The goal is to get out of the hospital as quickly as possible. Your attending physician is talking to a lot of different specialists. They are communicating. Yes, they communicate amongst each other a lot more than they communicate with you. But most of the doctors that I've worked with are very good at communicating with the families and notifying them and keeping them on top of things. It usually helps when family members are there when the doctors are rounding. A good idea is like to come in early in the morning, probably like at the beginning of visiting hours, and be there until lunchtime. Most doctors will finish their rounds before lunchtime. So whether they're starting with you or ending with you in along their list of patients to see, that's usually being there and asking questions and taking notes is usually the best way to avoid this dissatisfaction. And then, your attending will come, and a lot of times the attending will say, well, you should ask the heart doctor, you should ask the neurologist, because they're probably waiting to hear from them too. And there's always some time that goes between like a doctor's assessment and then their communication, and in between they're trying to think what to do here and what should be the next step. So these are all the things that are happening when someone is in the hospital, and how it's being done, and what the following steps are. And obviously, once you start getting better, the goal is to get you out of the hospital as early and as quickly as possible. If you do have any questions regarding scenarios, you're just trying to understand what's going on and why this may or may not happen, what could you do? Just don't hesitate to ask me. Reach out, put your questions in the comments, or just leave some questions for me, and I'll be happy to address them. And once again, my name is Dr. Vikram Gupta. I'm a practicing family physician in the Clifton and Patterson area in North Jersey. And I will see you next week. Thank you. Bye-bye.